I have the pleasure of introducing Gary Stapleton, as he's already spoken, the division chief, co-director, director of the cardiac cath lab, is going to be talking to you about interventions in the cath lab.
Very good. Thank you, Vios. So I'm going to talk a little bit tonight. I had the pleasure of speaking about Dr. Chuck Mullins, who is one of the greatest innovators and dedicated his life to really developing our field of interventional cardiology. So Chuck made numerous contributions to the field outside of interventional cardiology. He actually served his time in the military in the 1960s and actually established the specialty of pediatric cardiology in the military. He subsequently joined Texas Children's Hospital at the Baylor College of Medicine in 1969 and spent the next 38 years of his career there until he retired in 2007. During that time, in addition to all the contributions he made in the interventional world, he was really known as a dedicated and gifted teacher who really spent his life really trying to impart his knowledge on everyone that came before him. He won numerous national and international teaching awards, and in 2010, our own society, SCAI, established the annual Mullins Lecture Series, which is sort of the keynote lecture for the congenital heart section at the annual meeting. He also was very influential in the training of over 200 cardiology fellows at Texas Children's, as well as a number of interventional cardiologists at Texas Children's, including myself. And he also traveled around the country and the world training several other people in the field throughout his career. I think a lot of us are very familiar with the Mullins diagrams. We've seen these all over cath reports and the medical records and hanging up in the post-operative surgical wards. And I think these diagrams really kind of have aided us all in really understanding, giving us an overview of cardiac anatomy and hemodynamics and interventions that occurred in the cath lab. His initial book on these was published in the early 1990s, and these contained about 160 hand-drawn diagrams that he did himself that really kind of demonstrate his attention to detail and passion for the field. And the current version of PEDCath, which many of us use as a reporting system from the catheterization laboratory, there's now over 1,200 versions of these diagrams as we've all kind of modified them and continue to contribute them. He made a number of contributions to interventional cardiology, but really what he also contributed a lot to was just our understanding of how to do a diagnostic catheterization and get the required information needed, particularly in the late 60s and early 70s, before really ultrasound and echocardiography became as advanced as it is now. He was the first to describe the use of percutaneous sheaths for getting vascular access and demonstrated this in the early 1970s for this to really be a safe and feasible way to obtain vascular access in small children for diagnostic cardiac catheterizations. He's certainly well known for transeptal punctures and getting access to the left side of the heart to get diagnostic and angiographic information and subsequently to perform interventions. He was very involved in developing the technology and the science behind doing this, and really spent a lot of his time really flying all over the country and the world teaching people how to do this valuable procedure, which we still use today to get access to the left side of the heart and to perform important interventions. He was very dedicated to understanding angiography, and he described the use of pulmonary venous wedge angiography to delineate the pulmonary arteries in patients who had truncus and pulmonary atresia and discontinuous pulmonary arteries, who before that we really had trouble kind of seeing them in their true form. He was certainly very dedicated to developing interventional techniques. The first picture you see there is the double disc Rashkin device for closing PDAs. And while he didn't invent the device, Baylor was one of the couple of centers who was involved in the early trials of this and actually had the largest enrollment of patients. He subsequently was involved in the development and concepts behind a lot of other occlusion devices. But I think what we really know him the most for in terms of interventional procedures is his contribution to the development or to the use of balloon expandable stents in cardiac disease. He started his work on this almost 30 years ago, had a number of landmark publications regarding this in the early 1990s, and really his philosophy and his teaching and the way that he went about this still influences how we approach stent implantation in congenital heart disease today. This is his book that he published in 2006, which really kind of describes his whole philosophy on catheterization in patients with congenital heart disease. It's an extremely detailed description of both diagnostic procedures as well as how to set up your catheterization laboratory and how to plan and approach a procedure. and then certainly a very detailed description of a number of interventions that were available at that time, and is really a useful tool for those of us who do interventional procedures in cardiology. Thank you.